Hey everyone, good afternoon. This is County Executive Pat Ryan. I hope you are doing well and enjoying, actually, I think one of the nicest days we've had all summer. So I hope I snuck out for a walk for a few minutes. I hope everybody else is able to do that or more. And today we actually have two somewhat substantive topics in addition to the COVID updates related to schools and school reopening and gyms. So I'll try to hit the high points on those and get everybody back to their day, but I do want to share updates on that as well as just the overall COVID situation. So we are slightly changing one of our slides here. So for those of you that are regular watchers, you'll notice that our first slide is a little bit different. What we wanted to actually start with is just a very straightforward by the numbers of where we're at with COVID in the county. Top line in very good shape and continue to be in very good shape. So I am positive and encouraged by that. Since the beginning of the pandemic, we've had 2,210 total cases. You can see total tests are now over 66,000. Unfortunately, we've had 93 fatalities, but we have had 1,911, almost 2,000 that have been positive and now recovered from COVID. So we'll talk a little bit more about the new infection rate as we do in a few slides. But in terms of the overall situation, I think we continue to feel as good as we can given where we are, with that the county is in good shape, that we're doing all the right things, and most importantly, that we have to continue to do those things to hold things where they are. In terms of our hospitalizations, as you can see here, we've been holding very steady at basically zero or close to zero residents hospitalized due to COVID, thankfully. Right now we are at zero, so no Ulster County hospital beds have COVID patients, and that is good news, of course. In terms of active cases, meaning yes, we've had over 2,000 total cases since March, but right now in Ulster County, we have only 107 active positive COVID cases that we're currently tracking, which is a pretty healthy number, and we've been hovering right around that number between 100 and 200 now for several months. Most important metric is really about, as we continue to test people, and we're testing hundreds every day, as we continue to test them, how many each day are coming back positive. That really gives us a sense of that moment in time snapshot of how are we doing with new infections. Very good news here. We tested over 500 folks, 539 residents in the last 24 hours, and only had 2 new positives of those 500 plus. So we are at a 0.37% infection rate, new infection rate right now. And you can see on the graph on your screen that minus a few small increases due to some of the prison testing, the state prison testing, we've been holding very steady right around 1% or under 1% new infection rate, which is where we want to continue to stay. Hospital capacity, looking out forward, we're in great shape, more than sufficient need there. 46 beds, regular beds, 10 ICU beds, and 41 ventilators. So rest assured that those are needed, or excuse me, are ready if needed, and hopefully are not needed. In terms of the numbers at a high level, that's really where we're at. As a reminder, just to give us some perspective here, it wasn't long ago that we were in very dire place in April and into May. And then we started to get things under control with all the different things that we've asked folks to do. And then we were actually able to start reopening the economy carefully, phase by phase. I know more slowly than some wanted and more quickly than others wanted, but in a very thoughtful way, we were able to move through the majority of these 4 phases and get the majority of businesses going again, and to do that safely and keeping those infection rates down is something that I think we all should be proud of, and I know I'm proud of and appreciative that everybody has done their part to get us there. As we continue to go forward, today we're going to talk about two new things that we're going to start opening carefully and slowly, which are gyms and schools, both of which I think we agree there needs to be some path to get back to some sense of normal, but also that we can't immediately rush to how things used to be. So we'll talk about what that's going to look like. But again, as a reminder and as a sort of an imperative really to keep moving forward, beyond what schools can do or gyms can do or any business or any organization, it really comes down to each of us at the individual level taking responsibility for not just ourselves, but thinking about everyone's health in the community. And what that really means for most, as you now well know, is wearing masks, even when it's hot, maintaining social distancing, even when you really are sick of not getting to interact with people, and I know it's tough, and washing hands and continuing to use hand sanitizer, especially when you're out and about doing grocery shopping or whatever critical things you need to be doing. Those things are working, and we know the science increasingly shows they work, so please keep those up, especially as we get more things open and going here. So to transition to that, we talked a little bit about this and put out a press release over the weekend, but I wanted to give some more context to everybody about our schools and what's happening with our schools in Ulster County, in the region, and really in the state. The short answer here is that each district, and we have 9 different districts that cover or that operate in Ulster County, each district is very, very different. They have different numbers of students, different footprint in terms of the buildings, different risk profiles, and just a different sentiment about what parents and community members want from that school. So each school in the county and in New York State is really coming up with some, of course, guidance from the state health department, coming up with their plan and their detailed plan for how to get kids back to school in some form or fashion, and to do it, of course, with safety and health top of mind. So within our 9 component school districts, we have a whole range. We have at least 3 school districts, Kingston, New Paltz, and Saugerties, that have decided, at least for some period of a few weeks into October, they will start with only online learning and then plan to eventually transition to in-person or hybrid if it makes sense from a health perspective. Other districts are going to bring some students back. So there is not a universal plan, and I think that makes sense in terms of each district having its own sense of what's best for parents and teachers and students. And so I totally support that approach, but from our perspective, and my perspective being responsible for the health and the safety of all the residents, we want to make sure that we as a county government, we are supporting those school districts and to make sure that whatever they're choosing to do, it's done as safely and carefully as possible. So we've spent quite a lot of time working with the school districts, with our health team and health commissioner, and our other critical departments, and developed, similar to what we've done in senior facilities and other parts of the reopening, we've developed a school-specific rapid response plan, and it will be the same plan in terms of the support that we're offering for every one of our districts countywide. So there's really 5 aspects to this, and for those of you that have been watching these will sound similar, because this is the same approach we've taken to respond to other clusters as they've emerged, as we've responded to some of the challenges we've had in senior facilities. It all starts with working with the school districts to identify early and screen any possible cases. So there's a robust screening process of temperature checks and other checks to make sure that those that are sick won't get into buildings as they open. And then we will have a comprehensive testing plan to support each school district between their staff and faculty, as well as students as needed. In terms of what happens if, God forbid, we have a positive case in a school, which I think is frankly likely to happen. It's not a question of if it happens, it's a question in my mind of how we respond quickly and make sure that we respond seriously and really control that spread. So to that end, we have created a school-specific team of public health nurses, of senior leaders from our health department and our emergency response team to, in the case of a positive contact for COVID in a school, to be that rapid response team that in most cases will actually show up in person and to be on the scene and help the school leaders through all the protocol that needs to be taken and to ensure that we really protect the wider school community and all those other folks that are involved. That will be a series of isolation and quarantine steps. It will kind of depend on the situation, but it really all ties back to the contact tracing process to figure out where that positive individual, whether it's a teacher or a student, where they were, who they came into contact with, and how to keep them isolated and, of course, safe and healthy. Key to this, of course, throughout, especially given the complexity of school operations, will be communicating. So our team and myself, as well as, of course, the school leaders, as part of our rapid response plan, will be regularly updating the school community on what's happening so that we all have all that information. And then also critical to this, as we know, is having adequate equipment and particularly PPE and masks. If we are going to ask folks to come back into schools, we have to make sure not only do we have the screening and testing right and the contact tracing right and a plan to respond, but that we actually have the right safety equipment. So to that end, our team has worked hard and secured now over 30,000 masks that are ready to be handed over to each of our 9 districts. That's enough masks for every single student and every teacher and every staff member to have their own reusable cloth mask. And then we also have some of the KN95 masks for all of the in-school nursing staff and medical staff that are at each of our schools in the county. So of course we want to make sure, we know there have been challenges with PPE and that one mask doesn't necessarily meet the need for everybody, but at least this is a starting point to make sure that every student and staff and faculty have at least that to protect themselves and to protect others in their school community. So I know that the decision of when to reopen and how to reopen, particularly as a parent myself, it's a really, really anxiety-provoking thing, and it almost feels like no matter what, we can't do it perfectly. We can't get every concern addressed. And I think that we have to be honest with ourselves that this is really hard, that it's essentially unprecedented. But I want every parent and student and teacher to know that there is a lot of time and thought and planning and care, really, that has gone into thinking through these plans and to try to balance all the things and all the needs that we're hearing from teachers and parents and young people. And this will be a learning process for sure as we get going back. I just want you all to know that, again, we've put thought into the preparation, but also that as a county, I feel we are as ready as we can be for those districts that do choose to go back in whatever way they do. We will be here ready. Our public health team is ready. Our emergency response teams are ready. And so at least there can be some sense of relief and confidence that for those that are going back, we've been through this already in opening other things, and I think we can take that same approach to our schools. So more to come there, but that's the latest with our school rapid response plan. And then on to another topic that I know many people have anxiously been waiting for some progress on, which are gyms and fitness studios and other businesses that operate in that category. Originally, as many of you know, these businesses were supposed to reopen in phase 4, which happened now many weeks ago. But because of specific health concerns flagged by the state health department, they wanted to better look at the risks before putting out guidance about how to safely reopen our gyms and fitness facilities. So yesterday, we finally got that guidance from the state, and I know that many of our local business owners were at least relieved, and I was too, that at least now we know what the guidance is and what the rules are, and myself and other county leaders around the region have been asking for that, and I'm glad that we did that our businesses did get that guidance. So now it's on us to take that guidance and implement it, and to do so safely and quickly. So how are we going to do that? Well, before I talk about how we're going to do it, I'll just quickly hit on what the guidance was from New York State. So as part of our Ulster County gym reopening plan, we'll primarily rely on that state guidance. And what that looks like is gyms throughout New York State can open as soon as next Monday, the 24th, and no later than September 2nd. Some of the major limitations, though, to ensure safety and health. Number one, it's 33% capacity of the normal capacity for that gym. So that's both the overall facility capacity and then the capacity of any rooms or classes or equipment. The goal is to really have less people for obvious reasons. In addition, 6 feet of separation has to be maintained between individuals within a gym. And this one's going to be particularly tough, I know, but masks must be worn at all times when in a gym, which to me sounds pretty difficult, especially if you're on a treadmill or some sort of cardiovascular. So that's the guidance. We've asked to make sure that does apply to cardio type equipment, and the answer from the state was yes. So we may not love that answer, but that is the guidance, and it was very explicit. The other limitation, which is important, is that the air filtration systems in gyms have to be at a certain level, and for those HVAC techs out there, it's the MERV 13 level of filtration and technology. That's the standard. So for all of this criteria, the way that the state process works is we as a county, our health department, will be required to inspect all of our gym and studio facilities to make sure that they're in compliance with all these requirements. They'll have to develop their business safety plan, just like every other business has done, and incorporate all of this guidance into that and make sure that they're posting those business safety plans where their customers and their workers can see them, just like we've done in all the other parts of our economy as we opened it. Then our public health inspectors will come and do that inspection, and we have 2 weeks to do that. Because we want to get our gyms back up and going, we are going to work as quickly as we can to get those inspections done. And we will allow the gyms to open starting the 24th, knowing that we then have 2 weeks to complete those inspections. So we don't want to hold you up, but we also want to make clear that you have to follow all this guidance, and if you're not, you will not be permitted to operate. The big outstanding question about our gyms from many folks is for group classes and how those will be treated. The state guidance was that it's up to the localities to figure that out, and we just learned this yesterday. So we are doing that analysis now to determine how we're going to implement that and what's the best thing for the health and safety of our residents and our county. So that's the one piece that I owe you more information on, and we will get you as soon as we can. But in the meantime, you can reopen all the other pieces, and I think it's going to just be a matter of a few days while we think through the implications of the group classes and how that's going to work. So if I'm a business owner that has a gym or a studio, what does this all mean for me? What should I be doing? This next slide kind of lays out the high level here. Basically, we're setting up a team made up of folks from my office, our health department, and our economic development office that supports all our businesses. We will work with every one of our gyms and studios. We've got just under 100 or so in the county, and we have a pretty comprehensive list of those. So we'll be working with each of you to help you really interpret this guidance, which I know can be confusing, and then also to get your inspection scheduled, which needs to happen quite quickly. So if you want to get that process started, the best thing you can do, we'll have this link up on our website within 1 to 2 hours. It's not up yet, but I promise it will be up this afternoon. If you go to ulstercountyny.gov/coronavirus, that's our normal COVID site, you'll see a banner that says, schedule your gym inspection here. You can go in and fill out that form, and we'll get you added to that queue. So like we've done with really all the other aspects of our economy in each of the 4 phases that we've gone through here, and I know it's been an arduous journey for all of us, we are committed, and I'm committed to working with our businesses to help you navigate this so that you can get going again, but also do so in a way that we all feel confident and that we're safe and thoughtful and responsible. And I know that we can do that with our gyms, just like we've done with everything else. So thank you to our gym owners in particular for hanging in there. And I know the pressure on you all in particular has been tremendous. I've spoken with many of you directly about this, and know that we'll be here now to help you get going as quickly as we can. So that was a lot of information on schools and gyms. We'll keep again, everyone updated on both of those topics and anything else going on more broadly as we continue to move forward safely and carefully. And please continue to do the work to keep the numbers low. Obviously, those two are intimately linked, that as long as we can continue to keep COVID in check, we can keep moving forward with carefully reopening things. And again, I think we've really proven that we are capable of doing this, thanks to everybody doing their part. So on that note, I will wrap up this update with a thank you, as we always do, to everyone that has been a part of getting us through this. March, April, May, some tough days in April and May, and still now navigating the reopening and doing it carefully. I know how tough this is on so many, and this is just some of the folks and groups and individuals that have helped get us through this. I know how much our teachers and educators and school staff and faculty, what they're going through right now, and really everybody on this list and more. Thank you for hanging tough, for thinking about others around you, for in many cases putting your life and your health in jeopardy to take care of others. I think it says a lot about who we are as a community, and I'm confident that we can keep that mindset. I know it's tougher and tougher every day, but I'm confident we can keep that mindset. So thanks to everyone also for tuning in. If you have any questions on anything related to COVID and our recovery and our reopening, you can always contact our Recovery Service Center. They are standing by on phones at 443-8888 or via our website, our web chat, or email. We want to continue to be here for everybody through this with the latest information, with hopefully the right decisions to keep everybody safe, and just really with a helping hand for so many that are under just tremendous pressure in terms of housing and food and mental health and addiction and just overall stress and anxiety. So we will get through this, and we'll get through it together. And I appreciate you taking the time to tune in. We'll see you on Thursday at 2 p.m. Be safe and healthy and stay resilient, and take care.